What is going on? So there is an awesome conversation going on Facebook right now in the Medicare billing group. Somehow we got on the topic of what you pay clinical staff and what the productivity expectations are and that kind of conversation. And so I shared my view, and one of the questions that came up was, around productivity and how many visits do you expect? And I said, well, expecting per visit productivity is really hard because I've hired clinicians early in my practice ownership where the clinician and I agreed on a number of visits per week or per hour, only to find out later that in the therapist's mind, a visit was 30 minutes, whereas in my mind at that time, a visit was 60 minutes. So they were doing 2-unit visits where I was expecting 4-unit visits. Clearly that was a communication issue that caused problems. That therapist, once we realized we were speaking a different language, decided not to come work with us, and that was totally fine. But the idea is there are absolutely metrics that every business owner needs to know. And I'll share another video talking about that. But tonight I wanted to talk about productivity. Now, in my mind, and I'm the first to admit it's warped as it is, in my mind, I'm not looking for more than one-to-one care per hour, right? And I'm saying that very specifically. I'm not looking for more than one-to-one care per hour, but that doesn't mean I'm looking for one patient in the clinic per hour per therapist. I tend to run a business the way I like to treat, and I tend to attract clinicians who like to treat the way I like to treat. And so while I've employed plenty of therapists that do an amazing job seeing one patient per hour and spending the entire hour with that one patient, I can tell you that I've never made any money hiring that therapist, and in most cases I probably lost money, but the only reason why that therapist was able to stay on the team was because they filled a purpose, they had a role. Even though I was losing money on every hour of pay for that therapist, I was hopefully gaining value in some other way. So for example, if we received a referral that I thought was appropriate for that therapist, because the personality of the patient and the personality of the therapist would match, I had the resource to allow that patient to go see that therapist, even though I was losing money. But I was making money because had I turned that patient away, I might have received fewer referrals from that physician. And so along with the referral that I lose money on, I gain referrals that I make money on. And as long as it's a net gain, the business will persist. Right? It's the same with third-party payer contracts. There might be a third-party payer contract that I lose money on, but there's others that I gain a profit on. And so as long as I have more than I'm gaining a profit and fewer than I'm losing money, it's still a profitable solution. That is why a practice like mine can accept a low reimbursement rate for a single payer, because we're going to make the money in other referrals from other payers or with other insurance companies from other physicians. There's always a method to the madness. But back to this for a second. Let's talk about what are some of the productivity standards. How would I run my clinic that matches my personality? Because it really does. Every clinic matches the management team's personality, matches the owner's personality. So I love groups, I love people, I love interaction, I love having 3, 4, 5 people in the clinic at the same time. I might not be billing for all 5 people in the clinic at the same time, and I think that's the difference between what we would typically think of as a high volume clinic versus what I'm doing. I'm somewhere in between. So basically, let's use a scenario. Let's say I have a new patient evaluation. I'm going to go to the extreme, but for my caseload, I primarily treat outpatient orthopedic. We do a lot of post-surgical total knee replacement. We do a lot of post-surgical rotator cuff repair. Everybody that comes to my clinic comes in, they're ambulatory, assuming they didn't just have surgery, but generally speaking, they're community dwelling, ambulatory. They dress themselves, they bathe themselves, most of them drive themselves unless they're unable to drive. But the idea is that I'm treating a relatively high functioning population, right? So with that, I've got a lot of flexibility and I've got a lot of leeway. So it's very easy for me. Say I'm going to start at the 9 o'clock hour. Let's say I have an initial evaluation at 9 o'clock. And it's a really simple, straight up orthopedic, persistent shoulder pain, non-post-surgical, no complicating factors. She woke up 3 months ago with shoulder pain. It hasn't gotten worse and it's progressively it hasn't gotten better and it's progressively stayed the same or gotten worse. Okay, pretty straightforward. She comes in, I do the initial evaluation, I do 1 to 2 units of treatment. I've got 30 minutes with that individual patient because the evaluation is an untimed code. I've already said no significant medical complexities or comorbidities, maybe some hypertension and diabetes, but it's all medically managed. So I'm sitting there at a minimum complexity evaluation. I've got time for 2 one-on-one billable treatment units. One of them might be manual therapy. The second one might be the home exercise program. And so my treatment philosophy is one in which I want to leave the patient wanting more. We're going to say this is a Medicare beneficiary. So there's no high copay involved. There's no high deductible involved. I want her to leave feeling good. This new patient comes into my clinic not knowing me, not knowing anything about the team, the staff. She's fearful. She's anxious. She thinks we're going to make her feel worse. I'd rather cut the session at 30 minutes and let her leave feeling like she could have done more with 1 or 2 things to do at home and a whole bunch of self-confidence to know that she actually can feel good in 30 minutes. So that's 3 units right there. The eval and 2 treatment units, all one-on-one. And then, so that takes us from 9 to 9:30. At 9:20, my next patient comes in. From 9:20 to 9:30, my next patient is doing an independent, unsupervised exercise program because they've purchased a fitness membership to my facility. It's only allowed to, we only sell fitness memberships to existing patients, but they bought that fitness membership. The second patient, let's say it's a medial knee pain, little meniscus issue. She comes in, she starts doing her stretches, her soft tissue work, her warm up, the stuff that I've shown her in previous sessions. That's non-billable, but that's what she's doing. So that at 9:30, I'm ready to start working with her. And from 9:30 to 9:45, I'm dedicated to that individual right there. So that puts me at 4 billable units. We're 40 minutes into the hour. And then at 9:30, right? So we're at 9:40 now, but at 9:30, my next patient came in. My next patient was somebody who had a shoulder issue. They come in, they paid their membership already for the month. They jump on the UBE, they do some soft tissue work, they do some levator stretch and pec stretch. And by 9:45, I finished my initial evaluation with 2 treatment units. I've taken care of a single unit visit with my second patient. And at 9:45, I'm ready for a single unit visit with my third patient. That puts me at 5 units on the hour very comfortably. These are 15-minute unit sessions, which are right in the average. If I really wanted to, I could push another patient in there, do 3 10-minute units. These are high-functioning individuals. These are not individuals that need me to supervise and coddle them and hold their hand and count their reps. These are individuals that are doing their exercises. They're coming in for a quick assessment. How am I doing? What's the next thing I need to learn? These are the next 2 things you're gonna do. Okay, now go practice them, right? And so within the hour, I can generally get 5 or 6 units of care, all one-on-one, not double booking, not treating multiple patients, all one-on-one units within a 60-minute episode. And that's not even talking about if I wanted to bring in like a hybrid model where maybe the patient that I evaluated the next day, I jump on a 10-minute telehealth call to see how they're doing with the home exercises I prescribed yesterday, to see if there's something new that I can progress them to today. That little 10-minute block is a billable unit. It's a single unit session. You know, we've gotten so stuck in the mindset that everybody needs 60 minutes one-on-one time with a licensed physical therapist. I just don't believe that. And I know that that it's not necessary because I have very positive outcomes. I have very high compliance. I have a great percentage of plans of care that are completed. And I think the reason why is because I'm not so stringent to say, this is your time, you better make it or I'm going to kick you out of the practice. You know, and even look at it from that perspective. So in the scenario I just shared, I had three or four patients that were in the clinic at the same time. Medicare guidelines, and I've got a separate video that shows you, Medicare guidelines clearly share this almost exact example of what you're allowed to do under Medicare billing regulations. So it is compliant. But what would happen if I had 3 patients booked for the hour, but one of the patients got sick and couldn't come? Okay, so I'll do 2 units for a different patient. You know, what happens if 2 of the 3 patients got sick and couldn't come? Okay, so I'll do 4 units on a single patient. Worst case scenario is I've got a 4-unit hour, but really the average should be 5-unit hours. And if I really wanted to push, if I was a super aggressive therapist, if I wanted to pay off my student loans and really make an impact, I'd be doing 6-unit hours throughout the day, you know, because I know there's going to be times that I'm just not going to get the 6 units. Me as an employer, I only expect 4 units. And the fact is, if you, the employee, and I, the employer, come to an agreement on what you're gonna charge me, what your rate is, right? Because you're setting the price. You're the therapist who's employed by me. You're setting the price to say, I will do this in exchange for that. And I can say yes or no. Just like if I said, I will pay you this for that, you can say yes or no. It's got to be a mutually beneficial agreement. Both of us have to come out ahead, or else it just makes no sense. You know, that's why in the conventional model, it's almost impossible for a business owner to hire a therapist and pay a fair rate, because the way the system is set up, it's just a disaster. It's the most inefficient system I've ever seen. If you wipe out all cancellations and no-shows, you wipe out the negative effect, the revenue loss of all of that, imagine how much more money is in the system without doing extra work. And that's the last thing I'll mention. People always get hung up on the fact that they're like, well, you're not doing one-on-one, you're doing 3-on-1. No, you're doing the same one-on-one care. The other stuff is the stuff that the patient is doing independently. Now, I can see them. I can talk to them. I can tell them if they're doing something right or wrong, right? I'm not gonna ignore them, but the idea is that that is not billable time. That is their time to do their exercise, work on their stuff. If you don't have patients that wanna work on their stuff, that's a completely different issue. That has nothing to do with productivity or billing or anything. That is poorly established expectations. But I think it's worth having this conversation. You know, let's break the mold, right? We don't have to be the high volume clinic that has 3 and 4 patients per therapist and billing every one of those patients 4 units an hour. So a single therapist is generating 16 units an hour. I think that's absurd. But on the flip side, I think it's pretty crazy for all populations to think that every single patient needs 60 minutes of undivided attention by the physical therapist. That's taking the pendulum and swinging it too far the other way. There is a sweet spot. The business model has to match the personality of the provider. Figure it out. If you have questions, post them in the comments. I hope this video was helpful. I hope this maybe sparked an idea, something that you might like to try or ask more questions about. Otherwise, I'll catch you next time.